Older adults are more likely than younger adults to have multiple chronic conditions such as hypertension, diabetes, cardiovascular disease, arthritis, or neurologic conditions, and are more likely than younger adults to require several medications to manage their conditions. Deciding on the right treatments for an older adult can be complicated for many reasons. These include physiologic changes that can affect pharmacokinetics, pharmacodynamics, adverse event profiles, as well as drug interactions. Polypharmacy is also often a concern for older adults. Insufficient clinical trial data in older people also limit the evidence base. Until recently, older adults were generally not well represented in clinical trials. As a result, the evidence base for guiding treatment in this population is less robust than for younger adults. Efforts are underway to ensure that more diverse patient populations are included in clinical trials. Therefore, enrolling older adults in clinical trials is important for supporting these efforts. Increasing communication with older adults about clinical trials is likely to improve enrollment. In fact, more than 2/3 of Americans say it's likely they would participate in a clinical trial if recommended by their doctor. In this video, we will review tips for communicating with older adults, including both general communication strategies and specific points for discussing clinical trial enrollment. Healthcare providers are increasingly cognizant of the need to be culturally competent and adapt care to meet the socio-cultural and linguistic needs of diverse populations receiving care. This need for culturally competent care extends to the care of older patients. It is helpful to initiate encounters with some sort of prompt to generate information that will allow you to better assess patients. Ask open-ended questions, make eye contact, and genuinely listen. Speak in a regular voice and address the patient by using his or her last name unless a more familiar relationship has been established. Pay close attention to sentence structure when conveying critical information. Shorter sentences are best. It is also helpful to use direct, concrete, actionable language when talking to older adults. Avoid the use of a highly variable pitch or sing-song approach, as well as terms of affection such as dear or honey. These approaches, used by some clinicians, can unintentionally offend the patient. Careful attention to nonverbal communication is also critical for developing rapport. Sit rather than stand, face the patient when you speak, and listen attentively when the patient speaks. Maintain eye contact as much as possible and try to minimize the amount of time spent looking at a computer screen. Addressing the patient rather than a caregiver is also important so that the patient feels engaged. Consider whether any adaptations are necessary to accommodate patients' special needs. For example, there are several strategies that you can use to effectively communicate with adults who have some hearing impairment. Slightly raising the volume of your voice and speaking a bit more slowly may be helpful. Use visual aids such as pictures and diagrams to help clarify and reinforce comprehension of key points. Introducing the idea of enrolling in a clinical trial can be a sensitive conversation and must be approached with care. Asking the patient for permission to share information demonstrates respect and can help the patient to feel engaged and empowered. Exploring a patient's beliefs and ideas about clinical trial participation is important. Using open-ended questions to explore their beliefs can help to ensure that useful information is conveyed. Participants should be well informed about all aspects of the clinical trial. Informed consent confirms that the participant knows about the purpose, potential benefits and risks of the treatment, and all required procedures before agreeing to be in the trial. The logistics of participating in a clinical trial may also be a concern for some patients. Be direct and upfront with the information and be sure to provide written documentation that outlines all the information. It is important to inform patients that participating in a clinical trial is a commitment and that enrollment is only the first step. covering the details about how the trial will affect the person's care and relationships with providers is an important part of the informed consent process. Patients are likely to have many questions about participating in a clinical trial. Make sure the patient knows that your office is a trusted resource and source of information. Assessing patient understanding at the end of an encounter is important to help ensure that patients grasp the information that was given to them. The teach-back method, in which the patient is asked to repeat back the information received, can be used to ensure that the patient understands the information that was provided. In summary, building trusting relationships with older adults is critical for healthcare providers, particularly when addressing sensitive issues such as clinical trial enrollment. For more information about our publication on evidence-based recommendations for improving face-to-face communication with older patients, visit our website.